Hello, how can I help you today? Okay. Okay. Well, did you submit a transfer for your other medications? Alright, let's see. What is your last name? Okay, and your first name, please? Alright. What we will need to do, this is going to be your first time using our pharmacy, correct? Well, welcome. We're gonna have to fill out a new patient intake form for just our purpose here at the pharmacy. I know it's boring, but we'll try to get through it as quick as possible, and then I'll go ahead and look over your prescriptions and see what we need to do for you. All right? Thank you. First and last name again, please just confirm for me. Okay. And what is your date of birth? All right, thank you. Can you tell me your current address where you reside? And the city? Is it this state that we are in currently? All right. And your zip code, please. All right. Now, what email address is best to reach you at about prescriptions or any other coupons for the pharmacy? All right, thank you. And a cell phone number for you, please. Thank you very much. And is that your preferred contact method? Would you rather email address or cell phone? All right. Would you like to receive text messages that your prescriptions are ready for pickup? Do we have your permission to mail or deliver your prescriptions upon request? Would you like to receive your medications with a non-safety cap, which is an easy open cap? Instead of the push down and turn, it'll just pop off. However, if you are around children, we recommend a safety cap. Okay. Now, do you have your insurance card on you? Yeah, go ahead and take your time. You can get that out. I will ask you a couple other questions in the meantime. Do you have any allergies to medication or any allergies in general? Okay. Do you have high blood pressure? High cholesterol? Diabetes? Or a thyroid disorder? Any other chronic conditions that you can think of? All right. Can you tell me a list of all the current medications, including over-the-counter, that you take each day? How many times a day do you take that? Anything else? All right. And is this just as needed? All right. Okay. Good. I do have your transfer request here with your new prescriptions. All right. Oh, do you have your insurance card? Okay. What insurance group is that? And what is your ID number on there? RX group number? Great. And can I have the last 4 digits of your social security number, please? Perfect. Thank you very much. I will just need you to sign down here at the bottom that you acknowledge our regulations, privacy practices, all of that. So here's this. You can go ahead and just sign there on the bottom. That'll be perfect. Alright, just give me a second here to look over your prescription fax order and fill it out. Member ID number 723605421. All right. Do you want your prescriptions to be here and you pick up unless you request delivery? All right. Do you have any allergies to amoxicillin or aspirin, codeine, penicillin? Any of those ring a bell? Okay. Do you have any of the above? Arthritis, asthma, cancer, diabetes, glaucoma, heart condition, high blood pressure, high cholesterol, or osteoporosis? All right. And these are your, okay. And who is your prescribing physician? I want to make sure that it matches here what we have on file. Okay, thank you. All right. Okay. I think we got everything. However, I will have to give you your first fill on all of these in a small plastic bag once you come back in about a week to pick up your large dose. Your doctor says that you want to try this out. Are you supposed to be trying the medication and then going back in 2 weeks? Okay, so I will give you just enough for your 2 weeks for what your doctor has prescribed, and then once you come back, if you're going to continue that medication, we will put in the plastic bottle for you. All right? Okay, so I'm going to explain the medications that you have been prescribed. Have you ever taken any of these? Okay. We will start with Zoloft. And here is Zoloft right here. These are 50 milligrams, small little pills. These are a serotonin reuptake inhibitor, so antidepressant. You are being prescribed 50 milligrams. Antidepressant prescribed for, of course, treating depression, obsessive compulsive disorder, panic disorder, PTSD, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder. Zoloft is available as a generic drug, so you don't have to take the brand name, but there's many other ones. It all depends what your insurance recommends, what the doctor recommends. Side effects. So let's talk about some side effects for this particular drug. Sleepiness, drowsiness, tired feeling, nervousness, sleep problems such as insomnia, dizziness, nausea, skin rash, headache, upset stomach or stomach pain, dry mouth, changes in appetite, and weight loss are some of the common side effects. Now, if you're having any of these issues, such as serious side effects, for instance, stiff, rigid muscles, high fever, sweating, confusion, fast or uneven heartbeats, feeling like you might pass out, agitation, hallucinations, fever, so on and so forth, you should contact your doctor immediately. You want to make sure that you are having a good experience taking this prescription and not a bad one, okay? So what we are going to do, let's see what your doctor has prescribed. Half in the morning, half at night. Okay, so we will be cutting these pills in half for you, and we will give you 14 halves because we will give you 28 halves. 2 weeks you're supposed to take them. That's my apologies. So we will give those to you. I will cut them for you. Okay. Alright. So, if you like, do you have a pill cutter at home? Okay. Sure. Well, I can cut a few and leave a few whole if you want to cut some yourself. Okay. So that is that one. Now we can look at riboflavin. This is riboflavin right here, which is a B vitamin. Very yellow and just tablets. And you have never taken riboflavin before either? Okay, so I'm just gonna go over it with you. Like I said, riboflavin is a B vitamin. It is involved in many processes and is necessary for cell growth and function. Now, I'm assuming that you were prescribed this for migraines? Okay, so I actually take riboflavin myself for migraines, and taking high-dose riboflavin by mouth seems to reduce the number of migraine headaches attack by about 2 per month. So, pretty good number. Taking riboflavin in combination with other vitamins, sand, minerals seem to also reduce the amount of pain experienced during a migraine. Now let's look at the dosage. If you are taking this for dietary reasons, the allowance of riboflavin for adults is 1.3 milligrams per day for males and 1.1 milligram per day for women, 1.4 milligrams per day for pregnant females, and 1.6 milligrams per day for lactating females. There is no daily upper intake levels for riboflavin, which is the highest level of intake that is likely to pose no risk of adverse effects, of course, because it is a vitamin. And the dosage for migraine headaches, which is what you will be taking it for, is 400 milligrams daily for at least 3 months. And yes, that is all. So 2 capsules in the morning and 2 capsules in the evening for 3 months. So you can do either or, apparently. So that's up to you, or whatever your doctor has told you. But I will give you enough for a month's supply, which is what your doctor recommended and wrote the prescription for. And let's look at the Nausea, which is an over-the-counter, but we have it back here because people tend to misuse it. Don't ask me why. Or they steal it. So your Nausea, which are these little tablets right here, chewable tablets for nausea. They are sodium citrate dextrose fructose capsules. Chewables, not capsules, chewables. indicated for relief of nausea associated with upset stomach, including that due to overindulgence in food and drink. So if it's a holiday and you stuff yourself and then you feel sick, pop one of these. But, however, you need to be careful if you have any fructose intolerance, which can be hereditary because these contain fructose. And antacids may alter gastric pH and interfere with absorption of some concurrent medications. However, you should be just fine taking these with the medications that you are currently on. So I will give you these. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. You can take these, let's see, to 2 to 4 tablets completely, and you may repeat after 15 minutes if needed. However, do not exceed more than 6 of these in a 24-hour period. Or is it 6 doses? Okay, so a dose is 2, alright? So you don't want to exceed 6 doses in a 24-hour. So don't take more than 12 in a 24-hour period. So I will give you these. These you can have just like this. I just have to make up small little bags for the other prescriptions. So if you just give me a minute, I will get those made up and you can be on your way. Alright, just give me 1 second. Alright, I got your pills all counted. 14 here, 28 here. What I'm going to do is take your direction sheets and the information about the medication, And I am just going to staple that on. Just like this, so you know what's what. And same thing with the Zoloft. And staple that on. That's there. And I will just give you the Nausea because it's over the counter. Alright. Do you have any other questions about your medications or anything else? Okay. Well, then you have a great rest of your day. I'll see you when you come back for some refills. Okay. Bye-bye.